Before your surgery, we strongly recommend you complete the following exercises. These will help speed up your recovery by maintaining muscle strength and joint movement. If pain is limiting these, please familiarise yourself with the programme so they can be completed after your surgery.
Ankle pumps. Lying on your back or sitting, bend and straighten your ankles briskly. If you keep your knees straight during this exercise, you will stretch your calf muscles. Repeat 10 times. Static quads. Lying on your back with your legs straight, bend your ankles and push your knees firmly against the bed. Hold for 5 seconds, then relax. Repeat 10 times. Hip and knee flexion. Lying on your back or sitting up in bed, bend and straighten your leg. To stop your heel from rubbing on the bed or to make the exercise easier, you can place a plastic bag under your heel to reduce friction. Repeat 10 times. Lying on your back or sitting up in bed, bend your operated leg and place a pillow or rolled up towel under your knee. Exercise your operated leg by pulling your foot and toes up towards you, tightening your thigh muscle and straightening the knee. Keep your knee on the cushion. Hold for 5 seconds and slowly relax. Repeat 10 times. Straight leg raise. Lying on your back or sitting up in bed, bend your non-operated leg. Tighten your thigh muscles of your operated leg and straighten your knee. Pull your toes towards you. Lift your leg up straight about 20 centimeters off the bed, but only take it as high as you can control it. Hold for 5 seconds. Repeat 10 times. Lying on your back, bring your operated leg to the side and then back to mid position. You can use a plastic bag under your heel to support and reduce friction if needed. Repeat 10 times. Knee extension. Sit on a chair and exercise your operated leg. Pull your toes up towards you, tighten your thigh muscle and straighten your knee. Hold for 5 seconds. Slowly relax your leg. Repeat 10 times. Hip abduction. Stand straight, holding onto a support. Lift your operated leg sideways and bring it back to midline, keeping your trunk straight throughout. Repeat 10 times. Hip flexion. Stand straight, hold on to a supportive surface. Lift the operated leg in front of you, ensuring that you do not bend past 90 degrees. Repeat 10 times. Calf raises. Stand holding on to support. Push up onto your toes. Repeat 10 times. Squatting. Stand holding onto a supportive surface. Slowly crouch or squat, keeping your back straight and heels on the floor. Stay down for approximately 5 seconds. Return slowly to standing, keeping your weight evenly on both legs. Repeat 10 times. Lunges. Stand with one leg in front of the other and feet hip width apart. Transfer most of your weight onto the front leg. Drop the knee of the back leg as comfortable. Tilt your pelvis forwards and hold for 10 seconds. Feel the stretch in the front of your hip of your back leg. Repeat 10 times. Hip extension. Stand straight, holding onto something for support. Bring your operated leg backwards, keeping your knee straight. Do not lean forwards. Repeat 10 times. Hamstring strengthening. Stand holding onto a supportive surface. Bend your operated knee and lift the foot off the floor. Hold for 5 seconds. Repeat 10 times.